Hey everyone, I am back. A lot has happened, so I want to give a little update. Um, so, bleh. um, in October, I was hospitalized for I think 7 days because I went into seems like every few months my MCAS, mast cell activation syndrome, tends to get worse every couple of months, and it's finally reached its breaking point to where I have chronic anaphylaxis at all times. Yes, even right now. Um, okay, let me explain. Where do I begin? I was in the hospital and I was getting anaphylactic symptoms to just being alive, just breathing the air, all of my foods, which I've only been on one food for the past almost year that I've been able to tolerate. And it was really bad. And the symptoms, more symptoms came on with it. So it wasn't just the throat swelling and the blood pressure. Now it was like my face was going numb. What's really weird is the swelling that would occur appeared to be minor, though it was affecting like my nerves more than anything. Like I remember I ate, and what actually sent me to the hospital was the whole inside of this cheek swelled up really bad. And if you don't know what I look like all the time, you wouldn't have really noticed it from the outside, but it was swollen. And along with that was like nerve pain, like in my jaw. It was excruciating. So obviously I went to the hospital because I'm like, fuck, this is gonna turn into anaphylaxis, like full on. So I go to the hospital, and at first they were like, you're making it up in your head. Then I gave them my packet from, it's literally a doctor's note that Dr. Afrin, who I went and saw in New York, like just recently before going to the hospital, the best, literally the best doctor for mast cell diseases, like probably in the world. I don't know. I went to see him, and he wrote a note in my portal and said that you can give this to your doctors or whatever. So I printed out like every single page. Like it was like a 21-page packet explaining things to whatever doctor doesn't understand what's going on with me. And I know that that's a lot to take in for any doctor. That's a lot of pages. They're not going to sit there. They don't have time for that. And I understand that. So I was trying to point out, the bits and pieces, and my Dr. Afrin even said, give them this number, give them this email. I'll talk to them and try to explain things. And I did that, and they did talk to him. And they had me on Benadryl through the IV and Solomedrol, which is basically prednisone, like around the clock. And I wasn't getting any better. None of my symptoms were going away. In fact, they seemed to be getting worse. We weren't exactly sure why, but it seemed to be that I was having some sort of allergic reaction to one of the medicines going into my IV. And I kept asking Dr. Afrin, what could this be? He said it could be from the vial that it was in. It could be from the rubber that they extract it from in the needle to give them an IV. And unfortunately, like, people like me, we have to have medications in hospitals that don't have preservatives, that don't have fillers and colors and things like that. And it's virtually impossible to get your hands on, in this country anyway. Other countries don't seem to have, well, some other countries don't seem to have as much of a problem doing that. So to make a long story short, my blood work was showing that the very high doses of this prednisone solomedrol drug, steroid, was causing problems with my kidneys and my liver. The enzymes were all over the place. I was feeling sicker. I lost 30 pounds during my stay. And I'm still dropping weight. A considerable amount of weight every week. Altogether, I've lost 35 pounds in, less than a month? I'm trying. Let's just put it that way. But as it stands right now, I am in Florida. Here's a palm tree. See the palm trees? I did make it to Florida, guys. I don't know how, but I will say this. I will say that, oh, let me find it. Okay. This is the only thing saving my life right now. Weirdly enough, now, it's lorazepam. Normally it's used for anxiety attacks and things like that. I was given this in the hospital because Dr. Afrin said that it was a mast cell stabilizer. And then it dawned on me, okay, so I actually used to take these over a year ago, every single day, 1 milligram split up, for 5 years. And I was able to eat like 10 foods. And obviously that's not a lot of food, but it's something, more than what I'm getting now. And when you are taking, sorry, I had to pop a Rolade. Anyway, when you're taking lorazepam twice a day for a number of years, it's not doing anything for your anxiety. Your body's already addicted to that dose. It's literally doing nothing. So I went to the doctors to get my new prescription because that's what I was told to do. This doctor became unhinged. He was like towering over me, like clearly he needed therapy. Like, this guy was unhinged. Calling me a drug addict. Saying horrible things to me, saying that he's going to cut me off of it cold turkey, which should be against the law. I mean, he should go to jail for that. Especially with someone with dysautonomia. You're going to cut someone off of a benzodiazepine cold turkey like that? Fuck no. I think not. So what did I do? I got him fired. Rightfully so. But anyway, I weaned myself off of the lorazepam using a scale and crushing it in powder form. That was horrific. Now, I know a lot of doctors will say, oh, well, that's such a low dose. You shouldn't have any side effects, like, coming off of it. Well, yeah, you do. Like, I don't know if everybody does, but I would assume. It's a benzo, and I was on it for 5 years. 1 milligram a day, split up. And it did. I was hallucinating people talking to me. Like, family members talking to me that weren't there. It was pretty gnarly. And I was getting like these weird brain tics, insomnia, severe anxiety, bouts of anxiety that were really intense. But, I got through it because I'm a strong bitch. That's why. Okay. But, so, when they had me on the lorazepam every 6 hours in the hospital, I was like, oh, shit. I really don't want to go on this drug again because some asshole down the road is going to be like, you're a drug addict, and cut me off cold turkey. And I have this like fear of that now. And my mast cell doctor, Dr. Afrin, he would probably have me on it routinely for probably almost the rest of my life, if possible. Now, since then, I have been to the hospital multiple times recently in Florida because I'm still going through the flare-up. It's not going away. And that's the problem here. But I wake up with the same swelling, the same whatever. As soon as I take a lorazepam, it dies down a little bit to the point where I can at least drink my PKU supplement and brush my teeth. I'll still sometimes get the numbness for a minute, but so how do I get food? So the one food that I'm normally able to tolerate is the only food that I am eating, but every single day it's terrifying. I have to eat this food in the ER parking lot because I have to take another lorazepam before eating it, and I still get bouts of anaphylaxis. Now, anaphylaxis. Unfortunately, doctors and a lot of nurses are not trained to actually understand what anaphylaxis is. When they hear someone suffers from anaphylaxis, they automatically assume, well, let's give you an EpiPen so you don't die. That's not the way it goes. There's 4 stages to anaphylaxis, and not everybody is going to need a fucking EpiPen. Try to explain that to a doctor who has their big old medical degree and knows everything about everything, and they will shut you down. Sometimes try to ruin your life because you stepped on their ego. I've had that happen. But, and then on top of it, okay, you're trying to sit there and say, I'm having stages of anaphylaxis happening at home, and I'm here, and, well, what meds are you on? Oh, I'm on lorazepam. So that automatically writes me off as mentally insane to a doctor or a hospital. They automatically, okay, she's nuts, she's got anxiety. It's all just anxiety, it's all anxiety, right? And then I sit there and I explain to them, well, I'm prescribed lorazepam not for anxiety, but for mast cell activation syndrome because it's a mast cell stabilizer. They automatically think you're fucking insane. It doesn't fucking matter. So, I mean, it's exhausting. It's truly motherfucking exhausting. It doesn't matter that I'm finally diagnosed. It doesn't matter that I'm seeing a specialist here in Clearwater. It doesn't matter. Most doctors in general, I'm not even going to go into it yet. You'll just have to buy my book when it comes out. I'm not done writing it yet. It's called White Coats. Kind of like red coats. But it's a take from a patient's view of things. And not just my view. I have other patients in the book. I have doctor interviews. I have all kinds of good stuff. But it's going to crack open a whole thing that you'll just have to read it when it comes out. I'll make an audio book for it too, for those that don't like to read. Like myself. I hate reading, but I write books. So how does that work? Anyway, I'm trying to remain as positive as possible. I woke up this morning with a very high heart rate because I have POTS. And I've been in another flare-up of sorts. It's been excruciating pain in my gut, and been getting weird nerve issues too. So when I'm sitting, my heart rate's okay, but I have to be careful standing up today because with POTS you faint, and I almost fainted taking a bath today. I cannot stand in a shower to wash myself. I have to sit, and a shower chair doesn't cut it for me because my legs are dangling towards the ground, and people with POTS, that's a problem. So what I actually do is I get in a bathtub and I sit cross-legged, which actually helps keep my blood up to my brain and my heart where it should be. But then when I get out, sometimes I faint or almost faint. That's called pre-syncope or syncope. For some reason, a lot of doctors and nurses don't understand what pre-syncope is either. Or like if you say that you fainted, they're like, well, how do you know you fainted? How do you know you fainted if you were blacked out? How do you know? just why do they work in the field that they work in? I'd like to know. Granted, this last hospital stay in Michigan was amazeballs. I mean, I was sick. I was going through a lot of scary moments. It was very, very scary for me. I have a lot of trauma that I'm trying to deal with the whole thing. That's really difficult to process because I'm still going through it every single day. I have an amazing boyfriend that is just awesome. Awesome. And the nurses at this hospital that I stayed at in Michigan were amazing. All of you were so freaking amazing. Faith, Candace, Prudy, I think that's her name. I'm so sorry if I can't pronounce your name right. I'm trying to remember. You guys, you're so amazing at what you do and who you are as people. And I will never forget you, and I love you. I'm going to start making more music again. Sometimes singing causes anaphylaxis, so I gotta be careful, But I'm trying to take it day by day, and I am in paradise, and if I'm gonna suffer, I'd rather it be near a palm tree. You know what I mean? So, I'm feeling better than I was because lorazepam is just keeping things at a level. But I'm not gonna lie, I'm still it's like a permanent flare. I don't know if it's because I went through COVID, or whatnot. COVID particularly goes after mast cells. It does things to the mast cells in the body, I think. Most of the time. I guess it depends on what kind of COVID. I don't know. I think I had Omicron. But anyway, the doctors, the nurses there, just thank you. Thank you. And I know that I have one of those really fucked up diseases that like nobody's heard of, and it's like if someone came into the ER and said, I'm allergic to air, I'm allergic to water, you know, I can totally understand why someone would be like, this is totally psychological, even though it's not. It's one of those really weird diseases. It's not even rare anymore, so I mean, it's gonna be popping up, especially people that have beat COVID are getting things like that, and POTS, and like other weird crap going on. It's gonna get weird out there, guys. All I'm saying is if you're a doctor or a nurse that works in a hospital or an ER, people are gonna be sounding crazy, just like me, okay? And just sometimes the things that we learn in medical school, I even went to a medical school, not for a doctor, I was doing nursing. Some of the things we learn in medical school isn't gonna be everything. It's gonna be what field we're going into. So really, unless you're like an oncologist, like if you're an oncologist, you're going to be taught maybe a little bit more about like mastocytosis and things like that. It's going to be at least in your vocabulary to some degree. But if you work at a hospital and specialize in immunology even, or allergy, you probably wouldn't have heard of mast cell disease, unfortunately. It's run by in medical school for like literally a split second, a split second, and you're not going to retain any of that information, and I don't blame you. And they're not going to say much about it, kind of like POTS. Okay, if you Google what POTS is, no, not even close. Do you know that people with POTS experience over 200 different symptoms? And it depends on like who you are, which symptom you're going to experience. Like, not everybody faints with POTS. Some people have like nerve problems with POTS. Some people have like blue legs. Like, I don't have blue legs. I get like red toes. um, like, some people faint. Some people lose their speech with POTS. Some people, their face droops like they're having a stroke. There's a lot. I, I've had heart surgery because of POTS, but then someone else might have it, a little bit better. I was bedbound for 5 years with POTS until I got my heart ablations. So, I mean, there's a lot more to things than what we are always taught in medical school. And all I'm asking is just for a little patience with those kinds of people, because I promise you that when something looks like someone is in a mental health crisis or is just playing crazy and making up things in their head because 2 + 2 does not equal 9. In some cases it does, I promise you. I mean, that makes no sense what I just said, but same goes for these medical problems. Like me, okay, I have medical PTSD. So when I'm in a hospital setting and I'm going through symptoms that could be deadly to me, I start crying and I start getting depressed and I start doing that. That doesn't mean that I'm crazy. That means that I'm going through something terrible and it's scaring me, because I'm a human being. I'm a human. And it's very normal to feel these human emotions. And everybody deals with things differently. Like, someone else that has anaphylaxis could just be like, oh, okay, I'm having anaphylaxis. Poke with an EpiPen. Oh, okay, I'm going to go to a party in about an hour. Like, it's no big deal to them. Someone like me, I'm super sensitive to shit. So, like, I've been afraid of dying since I was like 8 years old. It's like a huge phobia of mine that I was in therapy for. But then I actually got sick with a weird fucking disease that can actually fucking kill me. And it's terrifying. It's terrifying, especially because, not just because of the deadly symptoms that can occur, and then not knowing if something is going to turn deadly or not. Like, I could be sitting at home and all of a sudden things start swelling and like I start almost passing out and my heart starts racing. I'm like, is this going to kill me right now, or is it going to pass in like 5 minutes? Like, should I go to the hospital? Like, it's so confusing because it's so all over the place. So it's really hard to have a flare-up and have to go to the ER like consecutively every single day until the flare-up goes away and not look crazy. So just a little bit of patience with these people, please. Chronic illness. I went the same hospital in Michigan. I actually talked to the head of the ER. I forget his name, but he said, well, you have a chronic illness, and that's not deadly, so you need to stop coming to the ER. First of all, who taught you that chronic illnesses can't be deadly? Like, that's not a real thing. And if you think that that's a thing, then you should quit your job altogether. Like, wow, that's not good to be running an ER based off of that. So I've had instances where I've been abused in that particular hospital, as well as another hospital in Michigan, literally abused, gaslit more than enough times than I can even count. This one doctor, I'm not going to say her name. She was an ER doctor. She still works there, but she works at other places too. I fainted in the parking lot of that ER, and I wasn't even there. I was just there picking up paperwork, And while I was walking back to my car, it was 90 degrees out, and I had POTS really bad at the time, and I fainted in the parking lot. And an ambulance comes and picks me up and takes me in. And instead of helping me, they shoved me into the psych ward part of the hospital. And I'm like, great, they think I'm making this up. They think I just purposely fell on the ground, like whatever. And sure enough, they did. And I was trying to ask the nurse at the station in there what was going on. Like, I told her, like, I have POTS. It's not a big deal. I probably just need to drink more water and I'll be fine. Like, I can go home. Like, or you can give me some saline, and that would be beneficial because it's salt water and that helps POTS symptoms. I got ignored, and then they started laughing at me, and one nurse said, you're here because you wear a gas mask and you make up illnesses that don't exist. Literally, I wasn't even at the hospital for any of that. Like, I was just trying to go home with my paperwork. And there I was getting made fun of for wearing this. So what's the story with this? It's a painter's mask. It's got these filters that filter out smells, Vox, formaldehyde, chemicals in general. It's wonderful for me. Literally saves my life, especially now, considering I'm in a permanent flare-up at the moment until I start getting on medicine this month, at the end of this month, hopefully. This has happened at multiple hospitals where I've had to wear this often. I don't wear it all the time because I'm not always around to smell. And currently, at the moment, all smells, no matter what the hell they are giving me a lot of problems, and they could send me into an even stronger flare, and I don't want that. So when I'm outside, sometimes I'll put this on because people spray their lawns with chemicals, and I know what that smells like. People with mast cell disease, mind you, we have a nose like a hound dog. Okay, we can smell things like that other people can't even smell. Probably because we're just so fine-tuned to like having to know this shit. So, you know, even flowers, like something was blooming out here the other day, and it was causing me to have a little bit of a breathing problem. So I popped my mask on, and then I was fine. In a hospital setting, they use chemicals to clean the floors, to wipe down equipment. They use alcohol, they use bleach, they use all kinds of crap, and I can't do that shit. I really can't. And so I wear this. Especially if I'm in a bad flare-up, I will keep it on most of the time. And sometimes I'll take it off for a few minutes just to see if I'm going to react. And if I start feeling swelling going on, even slightly in my lips, popping it back on. And you know what? Doctors think I'm nuts for it. And you know, that's on them. I'm sorry. But, you know, it's not my fault that I'm sick. It's not my fault that I have mast cell activation syndrome. And it's not my fault that they're not educated enough to know how to help me. And it's also not my fault that they don't want to take my education or my specialist's education in order to actually help me instead of hurt me. That was my car telling me to shut the fuck off. Okay, anyway. It's not my fault. It's also not the doctor's fault for not knowing what the fuck to do. And I understand that. At the same time though, it is their job to at least listen, to learn if they can help me in that instant or not. I'm not a crazy person. I've been in therapy for over 6 years, and it's been well documented that I'm a fully sane person that has their head on straight and knows what the fuck they're talking about. This is well documented with me. I'm not some nutso, okay, that's coming in there, I need drugs, I need this. Like, no. It's just not a thing. It's not. Now, I don't know why doctors do this a lot, but it seems like they're on board to help me initially. And I'm like, oh, okay, I can breathe better. Like, this doctor doesn't think I'm nuts. And, you know, maybe he'll learn something in the process to help someone else, you know, and, oh, I can breathe, you know. They're going to give me medicine. They're going to actually try to help me here. That's wonderful, because that doesn't happen often. And then all of a sudden they flip. And they're like, well, we think this is all in your head, so we're going to send you home. You know, while your organs are in the middle of failing, they're going to send you home, you know. Totally cool. You're totally fine. It's just all in your head. Even though, you know, your blood work is showing that your kidney and your liver are being affected by this drug here that we're giving to you 3 times a day at 40 fucking milligrams. Yeah, no problem. We're just going to send you home because it's all psychological. It's all good. It's all good in the hood, man. No. See, something else is going on there, because those doctors have talked to my specialist. They know that it's not in my head. They know that I have documentation proving through blood work, through urine work, through bone marrow samples, through stomach and intestine samples, that I have this disease and this is actually what it's doing to me. Like, I have all the proof of that. So they know that I'm not making it up. So why do they do that? And that is a secret that I'm going to crack, and I'm going to do it in my book, because there is something that doctors are not allowed to speak on. That's all I'm going to say. That's all I'm going to say, because it's so obvious, and I've even had a doctor sort of spill the beans a little bit to me when he wasn't supposed to. Like, I don't know what kind of trouble they can get in. Probably lose their license, maybe worse. I don't know. But there's something else going on with that. And I've noticed it with myself with this illness. But I hear from a lot of other people, even with just regular known illnesses, you know, like someone's in a diabetic crisis and they're thrown out on the streets. Oh, it's all in your head. Like, they know it's not in their head. They can't all be that stupid. You know what I mean? They have a medical degree, or 2 or 3, like, or 4. Like, they can't all be that dumb. So there's something else going on here. It's gonna be crazy. I'm gonna crack it open, and it's probably not gonna be pretty, but it's got to be talked about, because people are dying when they don't have to die. The 2 friends that I have made that way before I was diagnosed with mast cell disease, that had mast cell activation syndrome specifically, they died. They didn't die from the illness per se. They died at the hands of doctors while they were hospitalized. And that's another thing that I need to bring up in the book, not just with mast cell patients, but just chronically ill people in general, that are mistreated for whatever reason. I'm not trying to, not all doctors are bad, and not all bad things that doctors do happen all the time, and all that stuff, but there's something else going on here. I'm just putting it out there. that is something that I'm going to spend time figuring out as soon as I get well enough to do it. The past 4 days I've been in bed dealing with a lot of really severe gut pain and weird nerve symptoms that radiate all the way into my back and my heart. I've been dealing with a lot of chest pain and a lot of weird nerve issues, and that's all new for me. But I'm determined to get well. I'm working with a specialist. I just sent in a bunch of tests and stool samples, and they're going to... here's another thing that's kind of interesting that was discovered. So, sorry. It was... Fuzz. This new doctor that I'm working with in Florida, I told her that I was on B12 shots every single week. And she said, well, do you have the MTHFR gene? And I'm like, yeah, I have the 2 copies of the C677T MTHFR gene. And she said, whoa, yeah, you can't do that. I cannot take that B12 shot. It was hurting me, and maybe that caused some issues that I don't know about. I don't know. But I just know that I started taking it, and then the mast cell disease got worse. There's a lot going on here, and I'm determined to eventually put my mast cell activation syndrome into remission, because I'm pretty positive on where it's coming from, and how to sort of smash it all back down again. Like, I'm not going to get rid of it, but I've had it forever, and I know the thing that sort of exacerbated it and made it what it is. Like, I know what that specific thing is. And so I need to heal that, and just, there's a lot that I need to do. But anyway, I hope everyone is having a wonderful day, a wonderful week, a wonderful life. And this video has become weirdly long, and if you're still here, I'm sorry. But I have to go to the grocery store. It's not, my car is saying it's 73 out. It feels like it's 85. Okay. But I'm gonna go to the store. I'm gonna get some more water, because that's like all I can take in anyway. And I'm going to get some food to cook for my man. I have to cook outside because I'm allergic to cooking smells. Isn't that fun? Oh, also, we have a dresser in the house that has been off-gassing for like 4 days now, because I'm allergic to it, to the chemicals that they put in the wood and stuff like that. And we washed it down too, and it's still not enough. So we've had our sliding glass door open for 4 days with a fan on it and stuff, and that could be contributing to my current flare-up right now. I just periodically smelling that, because I wear this in the house, but I don't want to wear this constantly around the clock in my own house. Like, this, it hurts my face. Pretty soon I'm going to need like nose surgery here. There's like a permanent bump there now. But anyway, enough talking. I'm going to go to the store. Love you all.